My name is Laura Fleischfresser. I am one of the co-founders and VP of Clinical Affairs here at Gratia Health. I'm really excited to kick off our summer webinar series, Level Up Workforce Motivation, with our first session today, which is Recognize to Perform. Um, just a little bit of background on me. I am a nurse. I have been in healthcare for over 20 years, so have a lot of firsthand experience on how tough it is to balance delivering care and doing it all with limited time and resources. So excited to jump in here today. Just a little background about Gratia Health and who we are. Um, we are helping health systems to engage, recognize, and retain frontline clinicians, while at the same time putting fun and joy back into work. Right? We want work to be fun. So we want recognition to be seen more than just as a feel good extra among all the various priorities that us as hospital leaders are facing, but to change that narrative and share today how recognition can really be such a powerful tool when it's done strategically and when it's done right. So hoping today that everyone's going to walk away with a great understanding, a better understanding of how really targeted real-time recognition strategies can lead to measurable performance improvements, and why traditional or generic one-size-fits-all recognition and rewards platforms and approaches oftentimes fail in the healthcare industry and fail kind of driving performance with our frontline caregivers. So with that said, let me introduce you to Emily. Emily is a nurse manager who works on a med-surg unit at one of our partnering hospitals. She is passionate. She is a reliable nurse. She was recently promoted to a manager position and really wanted to step into this role because she wanted to amplify her impact. And I'm sure this probably resonates with a lot of nurse leaders. She really wanted to help shape a high performing team. She's high performing. She really felt like she could leverage her skills to do that across her team. In this role, she is now kind of, privy to different performance metrics and data around how her unit is performing within the hospital, how they're performing towards strategic goals of the organization. And she's been intrinsically motivated. She is always eager to learn more. And when she started to see the numbers, performance metrics of her unit, she was shocked, really kind of taken aback as to thinking, why is not everyone as invested as I am at work? So she had to really change her lens, and really start to think about, okay, with this information, taking a look across the unit, she started to see some of the early warning signs of disengagement. It started to click for her. Oh, there were more errors in patient care that were creeping in. More med errors, more falls, more patient complaints. She was starting to see there were longer response times to call lights. So delays were becoming more frequent. Stress levels she noticed were higher. Burnout among a lot of the tenured nurses were becoming more prevalent. And really what she felt was a strong, supportive environment was now really becoming very toxic, and less supportive. So it was clear to her she needed to do something different. She needed to um, recognize her nurses. People weren't feeling seen and was starting to see really the impacts of disengagement that it was having on patient care. So, like many of us, Emily was, well intended. She sprang into action, and she worked with some of her leaders to launch several recognition initiatives. She designed fun, vibrant kudos boards that had staff photos and post-it notes that her staff and patients or families could leave a compliment or a kudos for somebody. She started quarterly awards to celebrate outstanding contributions from the team. And started to give monthly shout outs in her team meetings, and start to really bring attention to the great work that she felt her team was doing. Initially, right, as any initiative, she was excited about this. She felt like her team was excited about this. But over time, it started to fade, and her kudos board started to collect dust. Those quarterly awards that she was doing started to feel more like a chore than a celebration. And the shout outs that she was doing at her team meetings just really started to feel like another agenda item and wasn't feeling like it was personalized to her team. So she was feeling stuck. And she cared so deeply, and truly, had a passion for being a manager and a leader, but at the same time, was just stretched so thin. And over time, right, those initiatives, as I mentioned, kind of began to dwindle and weren't landing with her team. Why? She thought and kind of partnered with us, is because recognition really needs to be meaningful. She was doing surface level recognition. It was delayed. It wasn't driving sustained engagement. She had a one size fits all approach that wasn't aligned with the daily activities or actions that her team was performing and doing. This was a manual process for her and a few team members that she had help her, wasn't scalable. And when it's not highly adopted by the staff, that was extremely hard for her to maintain and keep that going. So, that's where Gracia comes in. This is where we kind of stepped in and partnered with Emily and her broader hospital leadership. I really like to think of this as, we want to partner with our hospitals to turn appreciation into action and really work to take a new approach on moving from that feel good, kudos to do good recognition, as I sometimes like to call it. So, what does that mean? What does that look like? We have built in 6 critical elements into our platform here at Gratia to drive performance. Um, Quickly, the first one is organizational alignment, connecting recognition to goals. 2, it needs to be timely. Timing is everything. Recognition needs to happen more immediate and instantly. 3, I like to think of this one, social sharing, as part of our secret sauce, but let peers, let managers give praise. Majority of healthcare workers right now are Gen Z and millennials and are thrive on social networks. So that social sharing aspect is a great opportunity to build community. Fourth, personalization. So making sure that recognition is tailored to the individual. And then reinforcement, positively reinforcing and repeating a behavior or drive that repeat the positive reinforcement. And then lastly, actionable insights. So you have to be able to track engagement, track what's working, what's not working, and be able to adapt that and not wait for kind of lagging indicators or engagement scores to see, oh, okay, what we're doing is really not working. So what does this look like in action? Whoop, um, kind of bringing those six key elements to life here. I talked about Emily's challenges as a new manager, and when she started working with us and started working with Gratia, um, she had a team member, Mary. I'll share here. She's a dedicated nurse, a night nurse on Emily's floor. And she regularly picked up shifts and wanted to help with staffing gaps. This is a great example of a high impact behavior that, right, if you don't recognize people for going above and beyond, in this case, picking up extra shifts, the hospital is not going to run smoothly. It's going to be very time consuming for managers and not efficient for the hospital to take on patients. When implementing with our hospital partners, this is where we want to start. Let's identify, right, a high impact behavior that's aligned to an organizational goal. So that's what I mean by organizational alignment is really one of our top and key elements. In this example, picking up an extra shift aligned with Emily's hospital goal and Mary's hospital goal of reducing their reliance on contract labor and eliminating last minute critical shift pay. Secondly, the timing. And personalization. Our mobile companion app is really Mary's digital front door to recognition and engagement initiatives that the hospital has prioritized. This is really where Mary can track her progress and see her recognition and engage with her coworkers. This is how moments like Mary for picking up extra shifts and for her going above and beyond don't go unnoticed. She was able to receive a automated text notification that she received a new shout out on the shout out social feed within Gratia, and that was waiting for her when she signed in. It didn't get buried in her email inbox. She didn't have to wait for Emily to track her down at the end of her shift to personally say thank you. That can happen as well. But Mary was able to see in the moment and her peers, right, the recognition for going above and beyond, and in this case, picking up that shift. Because it showed up in the shout out social feed, this is where her teammates could react and comment, and this reinforces and inspires others for the behaviors. Millennials and Gen Zs, like I mentioned, right, make up 60% of our bedside workforce and crave connection. Mary's a little bit older, but it also helps her younger coworkers connect with her, and people know that, hey, I matter. Looking for that real-time feedback, looking for that sense of belonging that really extends beyond the workplace because of the mobile companion app. Fifth, reinforcement through gamification. This is, again, so key. Mary was able to pick up enough shifts that she earned a shift supporter badge and was able then to earn some points for achieving that badge that she was able to redeem for a reward in the Gratia Companion app. But more importantly than just earning a badge and the points, this gamified the behavior. This is how we make picking up shifts fun and continue to drive and reinforce the behavior that we want to see repeated. And then lastly, actionable insights for Emily and her leadership team. Because Gratia is tracking everything automatically, Emily's dashboard was able to be, updated in real time to see at an individual level and an aggregate level who's participating, who's not, and she's able then to take that information to inform her leadership of her unit's performance and how it's related to the broader workforce initiatives and staffing goals that they may have. So just one example of Mary and Emily, kind of how they use Gratia and for a high impact behavior of picking up extra shifts. But it doesn't have to just stop there. It doesn't have to be just one behavior. The same process can be applied really to any action or behavior. So thinking about what are those day-to-day activities that we want to reinforce, whether it be from attendance or precepting or mentoring new staff, or around quality initiatives and driving clinical excellence around documentation or care protocols. Across our partnering hospitals, we've have seen some some really great post-implementation results. We've been able to improve retention by nearly 5%. This is through that regular engagement with our platform, and nearly 3/4 of the staff that are using Gratia across the hospitals are using it on a regular basis. So we have a captive audience. We've got a great mechanism to communicate information and engage the team. Those who have earned badges have been able to we've been able to show have been able to are 4 times more likely to stay with a hospital, which is huge. They're invested. They are in it to win it across the games, and are feeling motivated through the Gratia application. And so in the case of the hospitals that have been using Gratia to have their hospital employed team members proactively help fill open shifts, we've seen a reduction in reliance on expensive agency staff, and that has decreased the cost and utilization significantly, close to 60%, as we've seen here. So for every dollar that is invested in Gratia, hospitals have been, sharing that there's a 10 times return in cost savings and value creation, which is really powerful when you think about how you can take recognition and really move beyond, just the kudos and the feel good to driving performance and delivering, hey, here's what our teams are doing good to impact our greater goals at the same time. So with that said, this is just the first of our webinar series, and wanted to just really give a flavor of what we are doing here at Gratia, and how we are partnering with hospitals and our platform to turn in recognition and engagement into performance. So I hope that the story that I shared with Emily and Mary resonated, or if anyone may be kind of feeling stuck or thinking, right, this isn't sustainable, you're not alone, you're not stuck. We would love to have you join us for an upcoming webinar. Our next one will be on July 16th, where we'll be diving in deeper into how we've been incentivizing and recognizing, rewarding the behavior of picking up shifts and attendance, and how we've been able to kind of demonstrate an impact on that area. August. In August, we are going to be focusing on care quality as well as professional growth. So more to come. But in the meantime, please don't hesitate to reach out if you have any questions or would like to kind of just book a complimentary session or design session. I'd be happy to share more and discuss more and kind of help everyone get kind of unstuck. So thanks again and hope to see everyone soon.